We all ready to go? Yeah, great, right. Good morning. Jerome Weimar here just for an operational update only on outbreaks. I think the Acting Premier has already been out today on wider government matters. Pleased to confirm today that we've got no new cases of community transmission here in Victoria. Obviously, we still have a lot of work to do on a couple of fronts of the outbreak, but after a solid day of testing, 25,500 tests yesterday, it's really encouraging to see no new positive cases coming forward today. We have 54 active cases of coronavirus in the community in the state at this point in time. There are still 3 members of the community that are currently in hospital, and I'll come to them a little bit later. Yesterday, we undertook 15,610 vaccinations. And again, my thanks to everybody who came out and got vaccinated yesterday. We continue, of course, to be the state that's vaccinated more than anybody else in Australia, over 1.8 million vaccinations across the GP clinics and across the state clinics. And again, my thanks to everybody who's involved in the vaccination programme. In addition to the 25,500 tests that we've already declared results for from yesterday, there are also a further 13,000 tests that were processed after midnight last night. Again, those are all negative test results at this point in time. And my particular thanks to people in South Melbourne and Port Melbourne who came forward to get tested in such large numbers. And again, this morning we're seeing a really good response to the exposure sites that we've listed yesterday. Exposure sites primarily associated with our new Epping private hospital case, again, that I'll talk about in a moment. But again, my thanks to everybody who's coming out to get tested today. It is so important indeed that we ensure that anybody who's been to those exposure sites or who may have had contact comes forward to get tested. Over 8,000 tests were completed in the first 2 hours of this morning, which is just a testament to the sheer hard work going on. We have additional testing facilities set up in South Melbourne and Port Melbourne. They're all, of course, very busy. We're also seeing good demand in the inner north, again, following some of the exposure sites in those areas. What's helped with that testing demand is we've sent around 100,000 text messages over the last 24 hours, both to those coming out of the QR code system, and it's really shown the value and the importance of the QR system, and again, the touching on and off. We're now starting to be able to use that data to really encourage people to come forward who've been to specific exposure sites, and again, it's good to see the response from the wider community to doing so. In terms of the South Bank complex and the South Bank outbreak, we've now tested everybody who is within the key townhouses or the apartments around the positive cases. I'm pleased to confirm that all 21 residents in the immediate surrounding apartments have all tested negative. They'll continue to be tested every 2 days as we go forward until we complete their isolation period. 182 other residents in those townhouses, again, we're working very closely with them. Over 90% of them have now returned a negative test result. We will continue to test people in that complex on day 5 and, of course, towards the end of this outbreak. 400 tests were undertaken yesterday at the pop-up testing site across the road. And again, my thanks not only to the residents for coming out, but all the other local people in the community who've come forward to get tested. 350 of those 400 tests have already returned a negative result. Obviously, more test results will come in during the course of the day. Again, we have a significant operation set up at South Bank, a lot of welfare support, food support. There's a concierge facility on site for between 7 a.m. and 9 p.m. at night. We're providing dog walking services. There's a lot of wraparound support. And again, it's great to see the community supporting this key outbreak at this critical point in time as we look forward to easing restrictions later on tonight. Finally on testing, we also have, of course, additional capacity set up, not only South Bank and Port Melbourne, but also the showground site has reverted to its 8-lane drive-through facility. We have waiting times of less than 60 minutes at the showgrounds, and there are other sites across the state in Melbourne which have availability for testing. In terms of the rest of the outbreak, City of Whittlesea, Port Melbourne, and the West Melbourne clusters, we now all have over 90% of their primary close contacts have now been cleared. So we really are very much in the last knockings of those particular outbreaks. My thanks to all the people, the thousands of people who've isolated in support of managing those outbreaks to ground. The R-Care aged care facility, 84% of primary close contacts have been cleared, and Reservoir is a little bit further back in the programme. So we'll work with them over the next week to try and clear those remaining PCCs. Yesterday morning, we discussed briefly a private Epping private hospital, a nurse that had contracted a coronavirus. We are expecting genomics later on today, so it's too early for me to be definitive about the acquisition of where the nurse may have contracted COVID from. Of course, the leading line of inquiry is that she is caring for the 3 positive COVID patients who came out of the Our Care facility about 10 days ago and who are in Epping Private for their well-being. Of course, it's very concerning to see the case of a nurse contracting coronavirus in a designated COVID ward. We're working very closely with Epping Private and their team. What we have at this point in time, obviously a lot of work's been done in the last 24 hours. We've identified 9 primary close contacts at Epping Private. They are all undertaking their 14-day isolation period. We've also tested, we also have an additional 25 staff who have been isolated. 22 of them have so far returned a negative test result, and as they clear the negative test results, they will be able to go back into the ward. We will continue a daily testing program at Epping Private for the foreseeable future until we clear through this outbreak and until those patients are returned to Our Care. One of the positive nurse also did 2 shifts of work at Northern Hospital on the 11th and 12th of June. As a result, we have 22 staff who have been identified at Northern Hospital who are now undertaking 14 days of isolation. They are primary close contacts. We'll support them to do that. The nurse also attended the Northern Vaccination Clinic on the 14th of June for her final dose vaccination. We've identified 30 people who are now Tier 1 PCCs, 5 staff, 25 patients. They've all been contacted. They'll all be doing 14 days of isolation. And what this really highlights, of course, is the importance of not seeing staff working across multiple sites when we have known COVID cases that they're looking after. I had a series of meetings last night with the CEOs of Northern and Private and Epping and other supporting agencies to ensure we re-establish a far more rigorous regime in place to look after these COVID patients. Finally, in terms of vaccinations, another solid day yesterday, 15,000 or so vaccinations. We've also taken now a total of 26,000 bookings on the online booking platform, and that's, I think, becoming a very attractive option for people to book their first and second doses of both Pfizer and AstraZeneca. We have 13,000 bookings available this week for second dose Pfizer. We are seeing those numbers coming through, and I'd encourage anybody who's due to get their second dose to please book it in as soon as possible. And with that, I'm afraid you'll have to put up with me for any questions.
Why was a nurse allowed to work across multiple facilities, given what we know about aged care facilities, given what we know about hotel quarantine? There are only 3 hospital patients with COVID in Victoria. Why on earth was that situation able to proceed?
Look, Rachel, I agree. I'm exceptionally concerned. We have very clear expectations and strong requirements of the designated COVID wards to look after our most vulnerable patients who are suffering with COVID. One of those expectations is that staff are dedicated to that particular ward and do not work elsewhere. I've had that conversation with the team at Epping Private. We'll be following up with them.
Have they given any explanation?
Not. We've had those conversations. I remain concerned. There are only 3 patients in Epping Private. Those are the 3 COVID patients. We have ensured there are no more agency or alternative location staff deployed there from this point forward. But that should not have been allowed to happen.
I imagine that would have been a very stern, even angry conversation.
No, we don't do angry. We're all on the same side trying to manage the situation. Obviously, I'm very concerned and disappointed that this has occurred, and I think the team at Epping Private recognise the severity of that, and are responding appropriately.
Why were they sent to Epping Private? And I guess when that decision was made, what did the health department do to ensure that risks like this weren't a factor?
So look, there was a significant team working on the preparation of the designated COVID wards. We have a total of 8 designated COVID wards across the state. There are 2 facilities, Epping Private and La Trobe, which are primarily earmarked for aged care residents as being more appropriate with the services they offer and the environment that they offer. And that work has been done. A lot of work by our infection prevention control teams, a lot of work by our colleagues in WorkSafe and other agencies, a lot of work around fit testing and ensuring that all the right measures are in place. This appears to be obviously an operational error being made at Epping Private that allowed the roster to be run in the way and the attestations for staff to be done in a certain way. That meant that we have a staff nurse working across 2 different sites. Should not have been allowed to happen. Had it not been allowed to happen, we would not have seen the impact on Northern Hospital that we see today with 22 staff being furloughed. So it is disappointing. I'm very unhappy about that situation, and the team understand that. They know what they need to do, and they're doing it now.
Are you confident there won't be a repeat of something like this?
Yes.
What part of the Northern Hospital was the nurse working in?
So look, I don't think I need to share that information. We know which ward she was working in. We've identified all the staff who have had access to that particular ward. The team at Northern have been, again, exceptionally supportive and helpful in this. There are at least 22 staff now that have been furloughed at Northern Hospital. There's a wider group of staff that have been temporarily stood down while we wait for their negative test results.
Was this the result of staffing issues, the shortfall in staff?
I think it was a result of. I think my understanding is that there are sufficient staff to support the work at Epping Private. I think there was an oversight in the attestation work and possibly a misunderstanding between the management and the individual concerned. Anyway, that's a matter for them to address, and they know they need to do that.
Are any patients at risk at either hospital?
No.
What gives you confidence?
Well,
that's not
there's only 3 patients at Epping Private, and that is the three COVID positive patients from our care. There are 5 patients that have been identified at Epping. They've all been tested, they're all being isolated, and they're being supported.
So this nurse only worked with 5 other patients?
That's right. But look, and look, recognising we have strong and stringent PPE requirements in all these hospitals, I understand there's some complexities about the way the case was being supported in Epping Private that led possibly to an IPC breach. And again, we don't have a definitive source yet, so it's not entirely impossible that the nurse picked it up from somewhere else. So I'm not, we have, these arrangements are in place, the structures are in place, the rules we have are in place to prevent these kind of things happening, and we're working very closely with the team to ensure they don't do it again.
Have 5 patients tested negative?
Yes.
Can you give us any more info on those investigations into how the nurse might have picked it up at Epping Private?
The leading line of investigation, clearly when you've got 3 COVID patients in a ward and a staff member goes positive, that's where you would naturally go to. We have genomic sequencing coming back hopefully this afternoon that will then either confirm that view or lead us into a different direction. We're of course doing the usual contact tracing work, so a number of the exposure sites that have been listed in the last 24 hours, the Crown Casino, some restaurants in the inner north are all associated with this individual. So we'll continue to work with her. Again, she's doing all the right things, and we'll work with her to trace it through.
In terms of what actually happened in Epping Private,
Yeah.
like what that potential IPC breach was, for example?
Well, again, the team is going through that work. We understand that, and again, I don't go into the details here, but there are some complexities around the way that some of the treatments of some of the patients are involved. It is entirely possible that it would have happened in that particular environment. There are, again, good stringent measures in place that should minimise that risk, but this is why we undertake the testing regimes we do, and this is why we have the arrangements in place in these COVID units to make sure that we don't see these kind of breaches.
So the rule is that if you're working on a COVID ward, you're not to be working at another hospital,
That's right.
or is it more broadly for hospital?
So there's a provision that says if staff are working in a COVID ward with positive patients in the ward, that then staff are not working across multiple sites.
Judging by the demand we've seen for the vaccine so far, do you think 83,000 doses a week in July will be sufficient?
No, we'd
Pfizer
always like more. We've seen, nobody has done more vaccinations in Australia than Victoria, and rightly so. We can see for ourselves the precarious nature that all of Australia is in, with always a threat of COVID coming back into our community. We're running at, between 150,000 or so, or running around an average of around 150,000 vaccinations a week across AstraZeneca and Pfizer, just in the state clinics. Across, if you include our GPs, we're running at around 330,000 vaccinations a week. And we still have people queuing around the block and trying to get in to do those valuable doses. As we've seen in the conversations over the last 4 or 5 days around the importance of getting second doses in and then having to reduce the number of first dose slots we have available to ensure the second doses can be done, there is a real constraint in the supply of vaccines. So I think all of us, both at federal government and ourselves here in Victoria, we'd all like to see more Pfizer vaccine available so we can get this job done more quickly.
Have you received any federal or TARGI advice that the recommended age of AstraZeneca is set to rise to 60?
No, not yet. So my team is in a meeting right now with the Commonwealth. I believe there's a number of conversations expected today around considerations of targets, but I've not yet received that advice.
2 people from New South Wales have died from AstraZeneca-related blood clots. Does that justify the lifting of the age to 60?
Look, I'm not going to speculate on Target's decisions or what they need to do. That's we ultimately and we always will rely on scientific advice. We rely on public health advice for our direction, both on the vaccination program and how we go forward. So, if Atagi make alternative decisions and changes their advice, we will of course have to reflect that here in
And
Victoria.
if that decision was made, would this be a major blow to our vaccine rollout?
Well, let's see if they make a decision, and if so, what that decision is. I can't speculate on what they may or may not do.
I don't think you quite finished your answer before, but with the Pfizer vaccines, is there any idea on when people will be able to make their first booking and first appointments? Do you know how? Just looking at
Sure.
at what we've got.
So look,
far?
in terms of the pipeline we have at the moment, so there are some first dose bookings available for Pfizer in the coming weeks. Not many. I don't have the number in my head, but there are slots available. If you go online, you can get a pretty good sense by clinic and by timescale when doses are available. But there are now relatively few. We have a significant number of second doses to come through in the next few weeks. We have, I think, 17,000 or so, 20,000 first dose appointments already booked for next week, and we'll expect to see really second doses driving next week. The concern we obviously have as we look forward into July is that the allocation of Pfizer to the state clinics reduces from the level we're seeing at the moment. That's an area of concern for us. Of course, we'd like to have more. We understand that our colleagues in the Commonwealth only have what they have, and they're allocating as much as they possibly can. That won't stop us from asking for more on behalf of Victorians. We know that people are desperate to get the vaccine. 91% plus of all the doses we've ever had have been put into people's arms. We'll keep that high level of efficiency, and we'll keep asking for more.
And just last one on the vaccine.
Sure.
The federal government says Victoria has been provided with a rolling 6-week forward plan, and that I guess they're saying that that's the certainty that you need there in terms of certainty of supply. What's your response to that?
Well, I think so. Absolutely right. We do get a 6-week schedule. We've got 5 million Victorians to vaccinate. We're not going to get that done in the next 6 weeks. So I would like to see a schedule that says how do we gear up and give people confidence about when they can get their vaccine and how long is that going to take. So that there's a level of uncertainty in that long-term projection beyond 6 weeks that I just don't have. So we continue very, very collaborative conversations with the Commonwealth to try and understand that. And in the short term, we'll always be asking for more because we have a demand for getting vaccine done. We know that's the only way out of this pandemic. We're living with this pandemic here in Victoria every single day, and the sooner we can get people vaccinated, the sooner we're out of it.
And back on AstraZeneca, obviously there aren't the same supply issues with AstraZeneca, although there is a smaller number or a different group, a limited group of people who are eligible for it.
Yeah.
Are you satisfied that enough of the people who are eligible are coming forward for the vaccine in terms of how many people you're seeing turn up and get AstraZeneca each day?
Yeah, that's a good question, Rachel. I mean, I think we're at this point in time, AstraZeneca is anybody aged over the age of 50 is able to get AstraZeneca. We've got walk-up appointments available across our clinics. We've got booking appointments available across our clinics. We're doing, we recognise that GPs are doing the heavy lifting, and they're almost only using AstraZeneca at the moment. So really every day, we did around 50,000 vaccinations in total yesterday across Victoria, across the GPs and the state clinics. About 2/3 of those will have been AstraZeneca. So it is still the heavy lifting part of our vaccine program at this point in time. I think there is more room for people to come forward, but right now in Victoria, 2/3 of those aged over 70 have at least had their first dose of vaccine. I think between the ages of 50 and 69, about 47-48% of us have had the first dose vaccine. So those numbers have really lifted dramatically in the last 3 or 4 weeks, and we'd like to maintain that momentum.
Do you have a message to anyone who might be in that category and wavering?
Oh, look, I think anybody who is eligible to get a vaccine, please come forward to get vaccinated. It's the one thing you can do in order to get us out of this pandemic, and regardless of which vaccine you're eligible for, if you're eligible to get it now, please come forward and get it done.
Right, if Atagi was to make that decision to raise the age for AstraZeneca to 60, what's going to happen to those Victorians in that age group who have already had their first dose?
Yeah, look, again, I'm not going to speculate with respect on the decision. I don't know whether it's being made on conversations I've not been briefed on. So, look, I understand. My team's meeting with the Commonwealth right now, as we are with all other state colleagues. If Atagi have made a different decision, then we'll have to work through what the implications of that are. The most important thing, I think, is what we've seen over particularly the last month, we've finally got the national rollout kickstarted. We've seen a significant surge of vaccination programs here in Victoria across both platforms. It is so important that we maintain momentum on our vaccination journey because it's the only way out of this pandemic.
Clearly this would pose a major issue to our rollout. Have there been conversations about this, about what it would look like, preparations?
As I said, the first conversation we're having with the Commonwealth is happening now. It started half an hour ago. So I don't know what the nature of that conversation is, because I'm standing here talking to yourselves. We will have to find out what that is and what the decision is, if it's a decision, what the change guidance is, and what it means in terms of supply of vaccines. At the end of the day, what we're seeing here in Victoria is a demand to get vaccinated. We've got 49 clinics, we've got people literally queuing around the block from time to time, we've got booking platforms, we've got call centres, people want to get it done, the capacity is here to get it done. We make no apologies for asking for as much vaccines as we can get for Victorians, and I think that's what people would expect us to do. And equally, I'm very grateful for a really good relationship with the team in the Commonwealth. We are doing a third of the heavy lifting for Australia, so I think they'd want to work with us, and I'm very glad that they do.
So who are part of those conversations? Who is part of those conversations?
Which conversation?
You were just saying that the health teams here are having conversations with the feds at the moment about the possibility of that advice.
Well, the Commonwealth has called a meeting at 11 o'clock this morning with all the health teams and vaccination teams from all the states to discuss where they are in the program. So I assume the stuff that you guys are reading on Twitter at the moment is all being discussed there.
Jerome?
I think Canada might be one of them. Have started mixing up the vaccines, first dose Pfizer, second AZ, or vice versa. Given the supply issues here and what happens with the Atagi recommendation today, have we had any conversations along those lines in Victoria?
No, not here. Look, and as everybody knows, I'm not a clinician, so not for me to judge on how you would mix or blend your vaccines. Look, it is something obviously we expect. We always look to Atagi for advice on this, and that's an integral part of the national rollout. Is the advice by Atagi around what is the right and safe way to do it in the Australian context. We recognise that here in Victoria we have a hunger and an urgency and a desire to get people vaccinated, and we've been very clear on that with the Commonwealth.
Pfizer supply, if my memory serves correctly, the federal government's been saying they're expecting an uptick in Pfizer sometime in July. Have they kind of flagged a date, whether it's in July or early August, something where they're expecting that supply to come
Yeah,
up?
I think the uptick the uptick we're being advised of is in September. So if I look at again, we don't have the projections going back to the earlier conversation. So we have a 6-week timeline that shows a reduction in vaccine availability in July, and look, we've known about that for a few weeks now. We're being told verbally that there's an expectation there'll be significant increases in Pfizer availability from September onwards. That's a really good thing, of course. We've got 3 months of winter to get through before we get to September, so the more we can get now, the better it will be, because we can vaccinate and protect more Victorians. So that's my focus at the moment. But I've not seen what those projections look like in September. And crucially, what does it mean for the state clinics? What does it mean for the GPs? And this is a complex logistical program, and that's why we have a large logistics team working on this. When you're running 49 clinics and you're trying to provide that throughput capacity, you can't set up overnight. So the more notice we have, the more clarity we've got, the better we can run this program for our citizens.
Perhaps a slightly tough question, but if supply wasn't a problem in that 3 months from September till the end of the year, so we do have a lot more Pfizer, how many people could we vaccinate in that time? The federal government's spoken of kind of a sprint at the end. Do you have any idea of how much we get through?
Look, there's a number of dimensions in that. It depends on, it depends on how does that vaccine get deployed between the GP network, between ourselves in terms of the state clinics, in terms of potentially the pharmacies have also been talked about. So, I have no visibility about what that strategic plan might look like in terms of how you scale up at that point in time. But we've also got to support the community to come forward and get vaccinated. This is not something you can just announce on one day and expect to happen the next. It's taken us a number of months to build up the momentum and to build up the systems and the clinical systems and the support and the processes to make this work, and to give people confidence that when they get vaccinated, it's going to be done in a safe way. We've got to stand up a workforce to deal with a much higher level of vaccination throughput if that's what we end up having to do. So there is a number of really important elements in all this. It's not just a question of turning up with a B double and a load of vaccine and saying, here we go, knock yourselves out. This is a really critically sensitive, important process that we have to support people to get vaccinated. I'm all up for doing big sprints. We've done a number of sprints along the way over the last 12 months. We'll do more sprints going forward, but if that's what we're going to do, we need a plan together.
Surely the 200,000 Pfizer doses going to GPs next month, that will be a big help, will it?
Yeah, I mean, fantastic. I mean, the GPs, here in Victoria, it's about a 50-50 in terms of vaccinations by GPs and state clinics. So we absolutely support, the delivery of more vaccine, and we've seen an uptick in vaccine delivery of both AZ and a little bit of Pfizer to GPs in the last few weeks, and that's a really positive step. We need all parts of the system to gear up. So we're very supportive of that, but I look at the 25,000 people that we're regularly doing through our clinics. I want to ensure that we can continue to provide them with a vaccination service.
Just going back to the nurse, did I understand you correctly? Did you say that was the case who'd attended Crown and the Village
Yes.
Cinemas?
That's right.
And in the conversations you had with the hospitals, can we be confident that that staff member is the only person who fell through the cracks? Did we find out whether there were any other staff members who worked at the COVID ward and at other facilities?
So my understanding at this point, our focus has been on this particular individual nurse. We are checking on any other staff movements between Epping Private and any other hospitals.
So it's too early to say whether
Too
they're
early
the
to
only one.
That's right.
And Jerome, on vaccines, is there an argument to suggest that Victoria should be given a bigger share of the supply of Pfizer, given that we're the ones coming out of this lockdown, an outbreak, there's a big demand here? Should we be getting a bigger share in comparison to other states?
Look, I think the answer I'd give, and I absolutely sympathise with our Commonwealth colleagues. It's a very difficult judgment to have to make around, how do you allocate such a scarce resource as we seem to have available to us here in Australia. I think what is very important is that we've got to be confident that the vaccine that is available to Australia is being productively used. So if it's being productively used across the country, that's fantastic. But we would like to be confident that it's not. That it's going to places where there is a demand for vaccination to take place.
Do you volunteers and dog walkers in South Bank?
Yeah, sure. You want to do it, Blake? No, we've got. Look at it in all seriousness. I've been absolutely just overwhelmed actually by the level of support we're getting from the residents of Kings Park. I mean, this is a really difficult thing to do when the Department of Health turns up and says, we've got COVID cases in your community, we're going to ask you to lock down for 14 days. It's a very challenging thing to do because, like all of us, they want to go out and about and do the things we all expect to do. The community could not have been more supportive. We're running community meetings every day. We're getting great support from the City of Melbourne, from a number of agencies to deliver really good food and welfare and emotional support. And dog walking is a big part of that. If you've got a pet in that building, the pet's going out in a COVID-safe manner, and I think that's a good thing.
And just logistically, how does that work from a COVID-safe perspective, ensuring that the dog's not inadvertently a vector for transmitting the virus?
Yeah, I did actually go on site yesterday and had a look. I didn't manage to take a dog out for a walk yesterday. But there's a concierge team there with an infection prevention control team. What they're handling is all the food deliveries, medicine deliveries, and any other urgent deliveries that people need. So we're managing that in a very controlled environment. We don't want our friends at Uber Eats inadvertently picking up the virus. So there's some very tight controls in there. I'm confident that the pooches are also being thoroughly disinfected as they come in and out of the building.
Is it disappointing to see this escalating kind of arm wrestle between the state government and the federal government over vaccine supply when there are so many people who are missing out on getting the first dose?
Look, I think in fairness to everybody, look, this is an invidious position to be in. We're in a world now in Australia where we don't have as much vaccine as anybody would want, and that's a matter of global supply. It's nobody's fault. The whole world is demanding vaccine, and we're getting ours, but we're not getting as much as we would like. And particularly here in Victoria, as we're coming into the winter months, we really have a keen desire to get vaccination done. I think under that kind of pressure, clearly, people such as ourselves here in Victoria, we're always going to be asking for as much as we can possibly get because we have a population that wants to get vaccinated. And I think we've demonstrated over the last 3 months that we have a safe and large-scale system that can vaccinate more people than anywhere else in the country and do so in a safe and controlled way. So we will keep asking for more, and I appreciate there's some difficult judgments that our colleagues in the Commonwealth have to make about what's the broad allocation we can get.
Some epidemiologists are calling for people aged 20 to 30 to also get vaccinated because they're the most mobile, they spread the virus most. Has there been any discussion about that?
Not really. I think, again, there's a number of opinions out there about how you do vaccination programs. I think our big issue here is, and the questions have all gone to it, is there isn't enough supply. If you have more supply, to some extent all these problems go away and people can get vaccinated, we can just get on with it. I think the arguments we've taken to, and this is, we are part of a national rollout, and the National Cabinet has set the order of priority in which we vaccinate. That order of priority is very clear. We start with the people who are in the most critical workforces, who are the most risk of coming into contact with COVID, our hotel quarantine workers, 100% of whom have been vaccinated. We have our aged care residents, our most vulnerable members of our community. We want to make sure they're vaccinated. We then go through other critical workforces, and then it's an age-based cohort because those of us who are older have a greater risk of the negative consequences of COVID than those who are younger. And I think that's right. We can't keep chopping and changing, particularly with a limited supply. And I think we're best off saying there's a structure there. I think we're now in a place in Victoria where everybody over the age of 40 is eligible to get access to the vaccine. That's pretty much half the adult population. I think it's pretty simple, and I think people should come forward and get vaccinated.
And just to clarify, some people calling the COVID hotline have been told they only need to get tested to go to the snow if they plan on staying overnight. Does everyone need to get tested, or is it just people who are staying overnight in the accommodation?
So really simply, anybody who's got any symptoms whatsoever should get tested immediately, and that's something we're going to have to keep doing over the days or weeks and months ahead. Secondly, anybody who's been to an exposure site should get tested immediately, and again, that's critical to keep an eye on those sites, and it's been great to see people coming out yesterday. Thirdly, because of the restrictions easing tonight, people who are going to the snow resorts, whether you're going up for the day or whether you're going up overnight, need to get tested 72 hours within 72 hours beforehand, and be able to show your test results to the guys who let you into the ski resort.
And just to clarify, do people need to isolate if their only purpose?
If you're getting tested because you're symptomatic or because you've been to an exposure site, you need to test and isolate until you get your result. If you're going skiing, then you just need to get a test, and then you don't need to isolate. Get your negative result and show people.
Just for my question before, I don't know if you quite answered it. I was asking whether Victoria should get a bigger share of Pfizer vaccines, given that we're coming out of this period. And you said it's all about the utilisation of the vaccine. Rates show that we have the second highest utilisation rate behind Tassie, if I remember.
That's right.
So the demand's there. People are wanting to get the vaccine clearly in Victoria. Should we be given a bigger share of Pfizer?
Yeah, look, I think my response to that would be, look, it's not my decision. I'm not in the Commonwealth. I don't advise the Commonwealth. I'm always going to take a Victorian perspective. So at one level, I'm always going to say, give me as much as you possibly can, because we have people here we want to vaccinate. I think secondly, if I step back a bit from it, if you're taking an Australian perspective on this, you would say, I want to ensure we get as many people vaccinated as we possibly can. So those parts of the country which are able to demonstrate they can get on and get people vaccinated, it's in the national interest. In the same way as what we're dealing with here in terms of our outbreaks is a national agenda. This is critical to Victorians, but we're protecting the rest of the country by dealing with these outbreaks and getting them under control. That's so important. In the same way as our colleagues in New South Wales today are dealing with their little alpha outbreak, that's a critical national thing for them to deal with, and I'm sure they will.
So why don't our kids need to get tested if they're going to the snow?
You'll need to check with. I think the advice on that is that we are most concerned about. Kids on the whole, I think under the age of whatever, don't go to the snow on their own. They go with their parents. Our biggest concern is around the socialisation around the ski resorts. I think we've made a common sense judgment around this is the eligible group we're trying to get. What we're trying to avoid is, and we've seen, I think Brett Sutton, the Chief Health Officer, talked about this in the last couple of days, so I'm just going to echo what he said. We've seen internationally that ski resorts have been super spreader type settings and type environments. We've seen a number of examples of that in North America and in Europe. We don't want to replicate that here. We know, as we've seen in the last couple of days, we still have isolated, we believe, community cases or COVID cases in the community. We want to remove any risk of anybody who is still unknowingly carrying COVID into a really high-risk environment, and opening up the ski resorts is a particularly high-risk environment. So it's an appropriate measure.
Last question.
Sure. Business groups have suggested with QR codes that like we publish testing numbers every day, we publish the number of check-ins. Now they're all on one app, and they say if we establish a baseline, if there's a drop-off, the government can mention and businesses can be more vigilant on it. Would that be possible? What do you think of that proposal?
Yeah, it's an interesting idea. We'll certainly have a look at that and consider it. And look, we've had lots of conversations. Brett's had them, I've had them, government's had them with your representatives and people active in the business community, and absolutely recognise they have been incredibly supportive of the work around QR codes. And I know it's an additional thing we're asking them to do, but I think we've seen a really positive response to that. I know everyone's completely fed up with the pandemic, everyone's completely fed up with living under restrictions, and I think we are seeing QR codes, testing and vaccination as our 3 steps out of the pandemic. And I think businesses have actually has jumped on that and said, let us help you get the QR code thing right and adopt it in our businesses. And my personal experience over the last few weeks has been that I'm getting checked up on much more by businesses saying, have you checked in with your QR code?
In South Melbourne, leaving the queues to get tested because the wait times are just too long. How concerned are you that some people may not be getting tested because they
absolutely, I'm always concerned, and look, and absolutely recognise. And I saw and spoke to some of the members of the community queuing for testing yesterday. of course, no one wants to wait for 2 or 3 hours in a queue to get tested. Equally, we know it's something we have to do to make sure that we don't have COVID lingering in our community. If you look at the website today, if you look at the testing waiting times today, and it's a very predictable pattern. We're seeing obviously very long waiting times in and around those key exposure sites. You move a little bit away beyond that, the waiting times are much shorter. One example, Showgrounds is now running less than an hour. So anybody who is able to go to another site, I would encourage you to go to the site that's got a short waiting time that is still reasonably accessible to you. The waiting times also reduce in the afternoon. So if you're really finding in the morning this is just nuts, I'm not going to stand here all morning and get cold, check in again at 2 o'clock, 3 o'clock in the afternoon. Very often those waiting times become a lot shorter.
Jerome, just one more for me. That do you think it's selfish that some people say, we're not going to the snow now because we've got to get tested? So do you think that's selfish on those?
I'm not going to speculate. I've been called out before for using emotive language, so I'm not going to start again now. No, I think we're trying to strike an appropriate balance about, as we ease out of lockdown, and this is a step out of lockdown, and there'll be another step after that and another step after that. This is a process that Brett has taken you through a number of times. I think we've made a judgment call that says we want to enable, of course, with the ski season, the snow season upon us, people to go and use those sites. It's an additional control that says just clear a negative test. That doesn't, to me, seem like a terribly significant burden. Then again, I'm not a skier, so what do I know?
Will the showground still have 8 lanes open tomorrow morning?
Yes.
And you said you're being given about a 6-week indication of how much Pfizer supply by the Commonwealth. I know it's difficult because of international supply, but how much forward projection would the state want to be given?
Till the end of the year would be great. Any more questions? No? Good. Thank you all. Thanks, guys.